On this Sunday night, sending reinforcements. Ottawa's Children's Hospital calls in the Red Cross as flu cases climb, prompting a desperate plea from frontline physicians.
We've got flu shots that are free and widely available.
The cost of Christmas. Inflation casts a chill on holiday shopping and donations. Reform in Iran. A top official claims the country is reviewing its hijab law and abolishing its notorious morality police. Plus, striking a chord.
I play cello. I play viola.
The program teaching music to children in Vancouver's downtown East Side.
Global National with Farah Nasser. Reporting tonight, Jeff Semple.
Good evening and thank you for joining us. This cold and flu season is packing a punch. The Children's Hospital of Eastern Ontario, or CHEO, is now calling in the Red Cross for support as hospital staff struggle to cope with the so-called Tridemic of respiratory illness, COVID-19, RSV, and influenza. The flu has arrived ahead of schedule, with case counts climbing to heights not seen in years. And it's a similar story south of the border and across the Atlantic. So what's behind this bad flu season? Ross Lord went looking for the answer in our top story tonight.
The triple whammy of viruses is hurting more Canadian families by the day, like Alberta Health Services discharging respite patients from a pediatric hospice. It's moving staff to its overwhelmed children's hospital. A sad situation for Leah Luzier.
Honestly, my first reaction was anger.
She's been using Rotary Flames House since her son Braden was born with a rare genetic disorder 11 years ago.
It means that the people that scheduled their time to spend there for however long it's closed, they now have the option of nothing.
Hard-hit Ontario is also struggling to adjust. In a statement, the Children's Hospital of Eastern Ontario says, "We've responded to unprecedented volumes due to RSV, the flu, and COVID," forcing CHEO to ask other organizations for help, and will be partnering with the Red Cross, who will have a small team of staff starting next week to support our clinical teams.
It's yet another example that, we have a serious issue on our hands.
The flu is rarely fatal in children, but it's having a severe impact on many, and it's still on the rise. Health Canada's newly posted update shows for the week ending November 26th, there were more than 10,000 new cases of COVID nationally, more than 8,000 cases of flu, and more than 2,000 RSV detections. Some doctors say pandemic measures like masking and distancing have left immune systems more vulnerable.
And you've had less of those viruses circulating and less community level protection, that you see a resurgence of them. I mean, that's epidemiologically sound. Is that the only thing that's happening? I'm not sure.
A big contributor, he says, is what's not happening: getting vaccinated against influenza.
Very few are having the flu shot, and it's astounding to me, seeing how much flu we're dealing with, that people aren't really aware that they can do something to protect themselves against the flu.
Some flu clinics are only starting now, more than a month after the outbreak started, as Canada's disjointed healthcare system tries desperately to catch up. Ross Lord, Global News.
And Canada isn't the only country struggling to cope with a wave of illnesses. In the UK, parents are being warned about a spike in cases of strep A after the deaths of 7 children from the virus in the last 4 months. Doctors there are warning parents to be vigilant and check for symptoms such as rashes, headaches, and fever that can become fatal if not treated properly. And respiratory illnesses are also overwhelming the health system in the United States, fueled in part by social gatherings over the American Thanksgiving weekend. The flu is hitting particularly hard, with about 9 million cases and 4,500 deaths recorded. And that's on top of a surge in cases of COVID-19 and RSV. Jennifer Johnson reports from Washington.
Thanksgiving travel hit close to pre-pandemic levels in the U.S. last month, but millions of Americans are now paying for all the close contact that came with those holiday gatherings, with at least 45 states reporting flu cases at widespread or high levels.
There's kind of this rebound thing where we haven't been able to really gather during the holidays for 2 years. We might kind of overdo it this year. That just increases the likelihood that influenza can spread easily.
Flu hospitalizations haven't been this high in early December in more than a decade. Cases are 20 times higher than this time last year. Compounding the crisis, that shortage of children's flu medications seen across North America, as well as a lack of Tamiflu for adults. Across the U.S., the situation is much like in Canada. People are getting sicker and heading to emergency rooms that can't hold them.
The combination of the high viral activity and the lack of some of these available remedies and treatments is creating a worsening of this tripledemic.
Health centers here are also overwhelmed with the flu, COVID-19, and RSV cases, including in Orange County, California, where hospitals have declared an emergency status due to a lack of pediatric beds. 3-month-old Brixton Clark went into respiratory failure after contracting RSV.
He was really struggling to breathe.
After U.S. Thanksgiving, COVID hospitalizations reached their highest level in 3 months, with more than 35,000 patients treated. And Christmas, Hanukkah, and New Year's celebrations are just around the corner.
My plea to the community is use common sense, use the basics about spread of viruses, and try to avoid the emergency room unless you truly feel you have an emergency.
Doctors are urging Americans to get updated COVID-19 and flu vaccines. Experts say the pandemic has kept flu antibodies low, making millions of people more susceptible than ever as they get set for another busy holiday season. Jennifer Johnson, Global News, Washington.
In China, the easing of strict COVID-19 rules is prompting a mixed reaction. In Beijing, authorities carried away a COVID-19 testing booth overnight, symbolizing the end of China's zero-COVID policy that has locked citizens in their homes and forced them to take frequent testing, with negative results required to go almost anywhere. In the face of widespread protests, authorities are now loosening the rules. Now, China has refused to accept Western-made vaccines, relying instead on its own. And epidemiologists warn that China's healthcare system may not be prepared for the wave of COVID infections the country could soon face. Well, one infectious diseases expert who is all too familiar with navigating a medical crisis is Dr. Anthony Fauci. The top U.S. health official achieved worldwide fame for his work during the COVID-19 pandemic and for shepherding the rapid development of life-saving vaccines. His remarkable career has spanned more than 50 years, but in the next few weeks, he will step away from the top job. Our Washington bureau chief, Jackson Prosko, spoke with Fauci, reflecting on his career and his fears for the future.
Dr. Fauci, you're preparing to step away from NIH, and I'm just wondering how you're sort of feeling in these final weeks.
Well, it's a bittersweet feeling because I have been at the National Institutes of Health for now 54 years. I came as a 27-year-old newly minted physician, and I'm now a soon-to-be 82-year-old senior person in the biomedical research and global health establishment. So I ask myself, what do I have to offer the country and the world?
Yeah, I have to ask, as you look back on all those decades in public service, is there a favorite moment, a favorite memory, a favorite accomplishment that really stands out to you?
I've had the privilege of advising 7 presidents of the United States, starting with Ronald Reagan. The thing that I feel good about that, a high point, is that I established a separate division to focus predominantly on HIV/AIDS at a time when the world did not have much of interest in HIV/AIDS, even though it was insidiously creeping through the world, killing a lot of people.
You've been in the public eye through all of this, right? You've been in the public eye through your work with HIV, right through to your work with COVID. And I'm sort of curious what you've seen in the changes in public discourse and the challenges around communicating issues of public health to everyday people.
The politicization of science, where in the United States you have the adherence or not to very clear public health principles that are influenced strongly by one's ideology, where you should have a uniform approach towards an acceptance of things that are proven to be life-saving. That should never be. A person should not suffer and die because certain ideologies tell them that they should or should not accept the vaccine. It doesn't matter what your political ideology is.
Does that make you worry about what the response to the next public health emergency or next pandemic could look like?
The thing that keeps me up at night is the thing that has always kept me up at night. Unfortunately, that nightmare we're living through right now is the fact that we might have yet again another pandemic, and we will not be prepared for it if we don't learn the lessons of what we've been through right now.
Any advice for who comes next after you at NIH?
Yeah, I mean, my advice would be to stick with the science and follow the science and try as best as you can to articulate what these scientific principles are as best as you possibly can so that people could understand that. And by all means, stay out of politics.
And you can watch the full interview with Dr. Anthony Fauci on our website, globalnews.ca/globalnational. This holiday season is shaping up to be one of the most expensive Canadians have ever faced. Inflation is taking a big bite out of holiday spending, boosting the cost of meals, gas, home heating, and of course, presents. Marnie Blunt has the story.
Inside the kitchen at Ottawa Mission, staff and volunteers are busier than ever.
We're seeing a shocking increase in hunger on a regular basis.
And seeing major spikes in demand and need, driven in part by the pandemic and deepened by inflation.
It puts a significant financial pressure on our shelter.
The Ottawa Mission says their annual meal numbers surged from 495,000 pre-pandemic, nearly doubling to 938,000 this year. And the call for holiday meals has gone up more than fivefold. This year, they expect to serve 14,000 Christmas dinners, way beyond the usual 2,500. With food costs up across the board, budgets are being blown away.
But as you can imagine, if food has gone up by almost 12% overall, that means we have a cost overrun for our meal program of hundreds of thousands of dollars.
And with money tight for many, charities are feeling the pinch, too.
If money is really tight right now, rather than canceling that monthly charitable donation that you're giving, cut it down. So go from $30 to $20.
Inflation impacts also hitting small businesses. A recent survey by the Retail Council of Canada shows 6 in 10 Canadians are feeling financial strains and plan on looking for more deals this year. This boutique in Vernon, BC, has seen a slowdown in traffic.
You can't blame people. Everything is just so expensive everywhere.
And some are sensing a change in spending habits.
People are buying smaller items, and our bigger ticket items are a little sort of a harder sell right now.
Back at the Ottawa Mission, the team is committed to their cause, no matter the cost.
It's very unfortunate about the price of food, but we're not going to turn anybody away.
This as the Bank of Canada weighs one more potential interest rate hike Wednesday before closing out a year of record high inflation, with some forecasters expecting a quarter or half-point increase. Even that would bring Canada's key lending rate to the highest it's been since 2008. Jeff?
Marnie Blunt in Ottawa. Thanks, Marnie. Abolishing Iran's morality police. Coming up, the country's Attorney General sparks hope and skepticism after announcing potential reforms. Welcome back. Thousands of delegates from nearly 200 countries are gathering in Montreal this week for the United Nations COP15 summit, hoping to hammer out a once-in-a-decade deal to preserve biodiversity and protect the world's ecosystems. The summit comes after countries, including Canada, failed to meet the 2020 goals set out by the last biodiversity plan 10 years ago. Amanda Jelowicki has a preview.
Hundreds of police officers surround a conference center in downtown Montreal. They've secured a large perimeter around the building, preparing for the COP15 summit.
We can see that nature loss is accelerating, and that means we need to act quicker now, too.
Final touches are being put on boardrooms ready to host a massive delegation. Organizers say up to 20,000 people from 185 countries are participating in the 12-day conference. The goal, to adopt a new agreement protecting the world's plants, animals, and ecosystems. Everything from reducing pesticide use to managing invasive species is on the table.
It's extremely important. I would say it's a generational event. It's defining for us this year a new framework for biodiversity, a new deal for nature, if you like.
The ambitious goal some are seeking, an agreement to protect 30% of the world's water and land by 2030. In Canada, 14% of the land is currently protected.
There is a difference of opinion about the ambition and whether we will come away with a very strong agreement for nature. I'm not so sure.
Montreal is a last-minute stand-in for the conference after it was moved from China because of COVID restrictions. It's left security forces scrambling to get ready for expected protesters.
This is an event that, was declared a major event only several months ago. It gave us a lot less time in the whole planning.
The conference begins December 7th. Amanda Jelowicki, Global News, Montreal.
Turning now to the ongoing protests and political unrest in Iran. The regime's attorney general says the country's so-called morality police, which enforces strict religious dress codes, has been shut down. However, that claim is now being contradicted by Iran's own state media, saying the Interior Ministry oversees the force and has yet to confirm that decision. The Attorney General also says Iran's parliament and judiciary are also reviewing the country's mandatory hijab laws. Violent protests erupted back in September after 22-year-old Mahsa Amini died in police custody after being detained for failing to properly wear a hijab. Since then, more than 200 people have died during anti-government demonstrations. Donation discrimination. Still ahead, the calls to change organ donor policies that disqualify some Canadians over their sexuality. A Saskatchewan man is demanding health officials reconsider the rules for organ donations after he says his late husband's tissues were disqualified because of his same-sex marriage. As Cabby Malitharan reports, Dwayne Belcourt accuses Saskatchewan's health authority of organ donation discrimination.
I really think there's a double standard going on, and it's not fair.
Dwayne Belcourt is not only mourning the death of his husband, but is questioning why his partner of over 2 decades wasn't able to help others through organ donation. On August 30th, Merle Donkin died from stage 4 liver cancer. Belcourt received a call from the Saskatchewan Health Authority regarding organ and tissue donations and was first told Donkin was a great candidate to be a tissue donor. An hour later, SHA called again to clarify Donkin's relationship with Belcourt.
Actually, she confirmed that he had sexual relations with a man before 5 years. That disqualified him. All his tissues was disqualified.
Belcourt says the policy is discriminatory because they confirmed Donkin was a viable donor prior to their knowledge on his relationship.
You're throwing away good, viable tissue or whatever you want to take from him because he's a gay man and had sex with a man. And I asked him, did you ask that question of heterosexuals? And the answer was no.
Health Canada lists reasons that may be used to determine a deceased donor's risk of having a transmissible disease, including men who have sex with men, saying in a statement to Global News that it isn't law and allow for flexibility in approach, adding that during the examination process should include items that would determine whether there is evidence of high-risk behavior. The SHA tells Global News the Saskatchewan organ donation program is following federal guidelines. Through a statement, the medical director of the organ donation program says the intent is not to discriminate, explaining that the ability to test donor tissues quickly before transplant is limited. The current guidelines are in place based on research and clinical evidence. The SODP practices will evolve when national standards evolve. Belcourt says the guidelines are outdated, especially given the recent changes made to blood donation bans for gay men, and he is looking for answers.
They're advertising that we can give our blood, but they won't take anything else.
Belcourt says an equitable approach to the screening process is needed. He says he may consider taking legal action after consulting with a lawyer. Cabby Malitharan, Global News.
Next, a hopeful note. The Vancouver Music School changing young lives in a vulnerable community. Welcome back. It's music to the ears of children living in a vulnerable Vancouver neighborhood. St. James Music Academy is providing a program in the downtown east side that's helping kids to realize their potential. Jay Durant has that story.
We are pretending that we are holding a candy in your hand, right, Maya?
That's music terminology these young beginners can understand.
We imagine that we have bubbles under our arms.
For the past 15 years, the St. James Music Academy in Vancouver's downtown east side has been offering free lessons for kids grade 2 to 12.
Elbow.
Making music accessible for children living in the neighborhood.
Elbow.
Having grown up in the downtown east side myself, I'm very familiar with a lot of the different and unique challenges that children can be exposed to living here.
1, 2, 3.
When you see them hold their instrument, they have this spark in their eye, and they are excited to show the world what it is that they have to share.
I play cello. I play viola with the bow. And then she has her thumb in the corner.
These members of the junior program are just starting out their musical journey.
I would say I'm kind of good.
But it's a lot to learn.
I broke C by accident when I was trying to tune it. So here's a little tape. G. Maybe it takes a few months, maybe it takes a few weeks. It depends how they learn these basics.
But eventually they all work up the courage to get on stage and perform with the Academy.
We're next. You just relax, calm your body down.
Sometimes playing alongside established Canadian bands and musicians, and once even in front of the Dalai Lama.
I have heard some of the graduates speak about that they would have never been on stages at the Commodore Ballroom or the Orpheum. And in return, those students were able to share with these musicians something about their heart, their life, and their community. It gave them an inside look into the real beauty that does exist in this neighborhood that sometimes gets overlooked.
Generous donors are giving these kids the chance to learn to sing and play, whether it becomes a lifelong passion or just something new to enjoy after school.
I really hope to be like a songwriter or like make people happy for being able to play the violin.
Jay Durant, Global News.
Sounding great. That is Global National for this Sunday night. I'm Jeff Semple. Tonight's Your Canada is Bark Lake in Barry's Bay, Ontario. Thanks for watching. Donna Friesen will be back here with you tomorrow. Have a great night.